Hello everyone, now let us discuss about CPT coding guidelines for surgery, integumentary system part 4. In the current session, we will be focusing on CPTs of debridement, paring and cutting, biopsy, removal of skin tags, shaving of epidermal or dermal lesions. Now first coming to debridement. What is debridement? Debridement is a process of removing non-living tissue or necrotic tissue from pressure ulcers, burns and other wounds. Debridement is a process of removing non-living or necrotic tissue from pressure ulcers, burns and other wounds. Now coming to wound debridements. The wound debridement services are reported based on two things. First one is depth of the tissue removed and the second is surface area of the wound. Now when performing debridement of single wound, report the depth using the deepest level of the tissue removed. When performing debridement of single wound, report depth using the deepest level of the tissue removed. And in multiple wounds, sum the surface area of those wounds that are of same depth but do not combine sums from different depths. Whenever multiple wounds are debrided, sum the surface area of those wounds that are of same depth. For example, when a bone is debrided from a 4 square centimeter heel ulcer and a 10 square centimeter ischial ulcer, report the work as a single code 11044, which is nothing but debridement bone, includes epidermis, dermis and subcutaneous tissue, muscle and or fascia if performed first 20 square centimeters or less. So for first 20 square centimeters or less, we need to give this code 11044 for debridement of bone. So here the bone is debrided from a 4 centimeter heel ulcer and a 10 centimeter ischial ulcer. So 4 plus 10 indicates 16, which is less than 20. Hence, it is reported by only one code 11044. Now, when subcutaneous tissue is debrided, another example is when a subcutaneous tissue is debrided from a 16 square centimeter dehisced abdominal wound and a 10 square centimeter thigh wound. Report the work with 11042. Here, how many square centimeters? 16 plus 10, that is 26. So first you need to report the work with 11042, that is nothing but debridement subcutaneous tissue including epidermis and dermis if performed first 20 square centimeters. So the total square centimeters are 26. So for first 20 square centimeters you are reporting it with 11042 and for the next or second 6 square centimeters you are reporting with 11045, which is nothing but debridement of subcutaneous tissue each additional 20 square centimeters apart from thereon, along with 59 modified. Here, if you see in both the examples, the depth of the wound is not mentioned. Here, the depth of the wound is not mentioned and only square centimeter. Surface area of the wound is mentioned and we are summing it. Please note that point. Now coming to the various CPTs of debridement. The first CPT is 11000, which is nothing but debridement of extensive eczematous or infected skin up to 10% of body surface area or body surface. The next is an add-on code plus 11001 for each additional 10% of body surface or part thereof. The next is 11044, debridement of skin, subcutaneous tissue, muscle and fascia for necrotizing soft tissue infection, external genitalia and perineum. And the next code is 11005, debridement of skin, subcutaneous tissue, muscle or fascia for necrotizing soft tissue infection, abdominal wall with or without facial closure. Now the next code is 11006, which is nothing but debridement of skin, subcutaneous tissue, muscle and fascia for necrotizing soft tissue infection, external genitalia, perineum and abdominal wall with or without facial closure. Without facial closure. The next is an add-on code plus 11008, which is nothing but removal of prosthetic material or mesh, abdominal wall for infection. For example, chronic or recurrent mesh infection or necrotizing soft tissue infection. This is an add-on code. Plus 11088 is an add-on code, and plus 11088 should be used in conjunction with 10180, 11004 to 11006. The next CPT is 11010, which is nothing but debridement, including removal of foreign material at the site of an open fracture and or open dislocation. For example, excisional debridement, skin and subcutaneous tissue. The next is 11011. Debridement including removal of foreign material from the site of an open fracture and or open dislocation. Skin, subcutaneous tissue, muscle and fascia. Muscle, fascia and muscle. The next code is 11012, which is nothing but debridement including removal of foreign material at the site of open fracture or open dislocation, skin, subcutaneous tissue, muscle fascia, muscle and bone. The next is 11042, debridement subcutaneous tissue including epidermis and dermis if performed first 20 square centimeters or less. We have discussed in the previous example. The next is an add-on code and it is an out of sequence code. Hence it is indicated by number sign 11045. Debridement subcutaneous tissue including epidermis and dermis if performed each additional 20 square centimeters apart thereof from the first 20 square centimeters, or for each additional 20 square centimeters after the first 20 square centimeters, you need to report 11045. The next code is 11043. Debridement muscle and or fascia including epidermis, dermis, subcutaneous tissue if performed first 20 square centimeters or less. The next is an add-on code plus 11046, which is nothing but debridement muscle and or fascia including epidermis, dermis and subcutaneous tissue, each additional 20 square centimeters or part thereof. The next is 11044, debridement bone including epidermis, dermis, subcutaneous tissue, muscle and or fascia if performed first 20 square centimeters or less. The next is an add-on code plus 11047, which is nothing but debridement bone, each additional 20 square centimeters or part thereof. Now let us discuss an example. The patient was in an automobile accident and sustained an open fracture of left femur. Patient sustained an open fracture of left femur. On the day of the accident, the patient was brought to OR and open fracture was debrided of all necrotic tissue and debris. Under fluoroscopic guidance, the surgeon was able to manipulate the bone to create an ample reduction. What CPTs are to be reported here? So, under fluoroscopic guidance, the surgeon has done a surgery, that is nothing but manipulation of bone to create ample reduction. So, the CPT is 27269, which is nothing but open treatment of femoral fracture proximal end head includes internal fixation when performed. The next is the patient was brought to OR and open fracture was debrided of all necrotic tissue. So debridement is done here. Appropriate CPT is 11010 along with 59 modifier. Debridement including removal of foreign material at the site of open fracture and or open dislocation. Skin, subcutaneous tissue. Coming to next topic, paring and cutting. So, the CPTs of paring and cutting are, the first CPT is 11055, which is nothing but paring or cutting of benign hyperkeratotic lesion, for example, corns or callus, single lesion. So, what is corn and callus? A corn is a small area of thickened skin whereas callus is a larger area of thickened skin. So the CPT description of 11055 is paring and cutting of benign hyperkeratotic lesions, for example cons and callus, single lesion. The next is 11056, 2 to 4 lesions, cons or callus 2 to 4 lesions. The next is 11057, more than 4 lesions. Now let us discuss an example. The patient presents for destruction of 4 painful hyperkeratotic lesions located on the right distal dorsal middle finger, right mid dorsal index finger, right ring distal interpharyngeal joint and right distal radial thumb were pared with a 15 blade scalpel. What CPT is to be reported? Here 4 painful hyperkeratotic lesions are destructed using or pared using a 15 blade scalpel. The appropriate CPT is 11056. Paring or cutting of benign hyperkeratotic lesions, 2 to 4 lesions. Here the number of lesions are 4. Hence 11056 is the appropriate CPT. Now coming to next topic, biopsy. So the use of biopsy procedure codes, that is 11102, 11103, 11104, 11105, 11106 and 07 indicates that procedure to obtain tissues is solely for diagnostic histopathological examination was performed independently and unrelated or distinct from other procedures services provided at that time. In simple words, we need to report a biopsy code in the range 11102 to 11107 whenever the procedure is to obtain tissue solely for diagnostic histopathological examination and that procedure performed is independent and unrelated to other procedures or services provided at that time. Biopsy must be independent and unrelated to other procedures and it must be done to obtain tissue solely for diagnostic histopathological examination. In that cases only we need to code biopsy codes. And the biopsies performed on different lesions or different sites on the same day of service may be reported separately. The biopsies that are performed on different lesions or different sites on the same day of the service may be reported separately as they are not considered components of other procedures. And they are not considered the components of other procedures. Next point is during certain surgical procedures. During certain surgical procedures in the integumentary system such as excision, destruction or shave removals, the removed tissue is often submitted for pathologic examination. During certain surgical procedures like excision, destruction or shave removals, the removed tissue is often submitted for pathological examination. Thus, obtaining of tissue for pathology is a routine component of these procedures. In such cases, biopsy is not reported separately. Whenever obtaining tissue for pathological examination is a routine component of certain surgical procedures, in those procedures, biopsy is not reported separately. The next point is partial thickness biopsies and full thickness biopsies. What are partial thickness biopsies? Partial thickness biopsies are those that sample a portion of thickness of skin or mucous membrane and do not penetrate below the dermis or lamina propria. Partial thickness biopsies are those that sample the tissue that do not penetrate below the dermis or lamina propria. Whereas full thickness biopsies, they penetrate below the dermis or lamina propria into the subcutaneous or submucosal space. That is the basic difference between partial thickness biopsies and full thickness biopsies. In full thickness biopsies, the biopsy penetrates below the dermis or lamina propria. into the subcutaneous or submucosal spaces. Next point is sampling of stratum corneum only by any modality. For example, since skin scraping, tape stripping, etc. does not constitute a skin biopsy procedure and is not reported separately. Sampling of stratum corneum is not considered as a skin biopsy procedure and is not separately reportable. The next point is an appropriate biopsy technique is selected based on optimal tissue sampling consideration for the type of neoplastic, inflammatory or other lesion requiring a tissue diagnosis. Now coming to types of biopsies. Basically there are three distinct types of biopsies. The first is tangential biopsy, the next is punch biopsy and finally incisional biopsy. Tangential biopsy may be shave, scoop, saucerize or curette. Now first coming to tangential biopsy. The tangential biopsy is performed with sharp blade, flexible biopsy blade, obliquely oriented scalpel or curette to remove a sample of epidermal tissue with or without portions of underlying dermis. Tangential biopsy is performed with a sharp blade, for example, flexible biopsy blade or obliquely oriented scalpel or curette, to remove a sample of epidermis tissue. In tangential biopsy, epidermis tissue is removed with or without portions of underlying dermis. And the intent of tangential biopsy, which come under the codes 111022 to 111003, is to obtain a tissue sample from a lesion for the purpose of diagnostic pathological examination. The intent is to obtain a tissue sample from a lesion for the purpose of diagnostic pathological examination, with or without portions of underlying dermis. And the biopsy of lesions by tangential biopsy is not considered an excision. This is an important point. The biopsy of lesions by tangential biopsy is not considered an excision because it is a partial thickness biopsy. Tangential biopsy is a partial thickness biopsy which does not involve full thickness dermis, which could result in portions of the lesion remaining in the deep layers of the dermis. It can be done with or without the portions of underlying dermis, and even dermis is not fully penetrated. The tangential biopsy is a partial thickness biopsy which does not involve full thickness of dermis, which could result in portions of lesion remaining in the deeper layers of the dermis. Hence, excision of lesion is not done whenever tangential biopsy is performed. Now coming to next biopsy, that is punch biopsy. The punch biopsy requires a punch tool to remove a full thickness cylindrical sample of the skin. Punch biopsy requires a punch tool to remove a full thickness cylindrical sample of the skin. The intent of punch biopsy, which come under the code range 111004 and 111005, is to obtain a cylindrical tissue sample of a cutaneous lesion. Tangential biopsy, the sample is obtained from epidermal tissue, whereas punch biopsy, the sample is obtained from cutaneous lesion for the purpose of diagnostic pathological examination. And punch biopsy may require simple closure of the defect is included in the service. Punch biopsy is performed along with simple closure. Now coming to next type of biopsy, that is incisional biopsy. The incisional biopsy requires the use of sharp blade to remove a full thickness sample or tissue via a vertical incision or wedge penetrating deep to the dermis into the subcutaneous space. Incisional biopsy is a full thickness biopsy. The intent of incisional biopsy, which come under the code range 111006 to 111007, is to obtain a full thickness tissue sample of the skin lesion for the purpose of diagnostic pathologic examination. The intent of incisional biopsy is to obtain a full thickness tissue sample of skin lesion for the purpose of diagnostic pathologic examination. This type of biopsy may sample subcutaneous fat, such as those performed for the evaluation of panniculitis. Although closure is usually performed on incisional biopsies, simple closure is not separately reportable and it is included in the service. Now coming to multiple biopsies, whenever multiple biopsies are performed on the same day, for first lesion you need to code the primary biopsy code followed by corresponding add-on codes for each additional and subsequent biopsy. Now let us discuss few examples. Two tangential biopsies are performed. For two tangential biopsies, first you need to give primary code for tangential biopsy followed by add-on code for second biopsy. 11102 is nothing but tangential biopsy single lesion followed by add-on code 11103, which is nothing but tangential biopsy for each separate or additional lesion. Next case is 3 punch biopsies are performed. Here one primary procedure code 11104, which is nothing but punch biopsy of skin single lesion followed by 2 add-on codes for subsequent 2 biopsies 11105, which is nothing but each separate punch biopsy of skin, each separate or additional lesion. The next is 2 incisional biopsies. Here also one primary code and one add-on code. 11106 is the primary code for incisional biopsy and 11107 is the add-on code for incisional biopsy. The next scenario is here 3 different biopsies are performed: incisional biopsy, tangential biopsy and punch biopsy. So how are we going to code this scenario? First thing, primary code for the biopsy for first lesion 11106, incisional, which is nothing but incisional biopsy single lesion. This is the primary code. Though different types of biopsies are performed, that is the next second biopsy is tangential biopsy and the next biopsy is punch biopsy. Even in those cases also, you need to report the subsequent add-on codes for those biopsies, not the primary codes. This is an important point. First lesion is reported by primary procedure code followed by add-on codes for each additional lesion. So here for incisional biopsy you are giving primary code followed by add-on code for tangential biopsy and punch biopsy. Now next scenario is 1 punch biopsy and 2 tangential biopsies are performed. So for 1 punch biopsy you are giving the primary code 11104 followed by add-on code for 2 tangential biopsies 11103, 2 units. Now let us briefly discuss some of the CPTs for various biopsies. For biopsy of nail unit you should give 11755 and for biopsy of intranasal you need to give 30100. For biopsy of lip you need to give the code 40490 and for biopsy of vestibule of mouth the code is 4040808 and for biopsy of tongue anterior 2/3 the CPT is 41100 and for biopsy of floor of the mouth the CPT is 41108 and for biopsy of penis it is 54100 and for biopsy of uvula or perineum the biopsies are 56605 and 56606. For biopsy of eyelid skin including lid margin the CPT is 67810. The biopsy of conjunctiva is given by 68100 and biopsy of ear is given by 69100. We will discuss in detail about these codes when we discuss that particular system. Now coming to the various CPTs of biopsy. The first CPT is 11102, which is nothing but tangential biopsy of skin, shave, scoop, saucerize, curette, single lesion. The next is an add-on code 11103, tangential biopsy of skin, each separate or additional lesion. The next is 11104, punch biopsy of skin, single lesion. Punch biopsy includes simple closure when performed. The next is add-on code plus 11105 punch biopsy of skin, each separate or additional lesion. The next CPT is 11106 incisional biopsy of skin, example wedge, including simple closure when performed, single lesion. The next is an add-on code plus 11107 incisional biopsy of skin, simple closure, each separate or additional lesion. Now let us discuss an example. Patient presents to its dermatologist for the evaluation of 3 suspicious lesions. One on the third upper arm and one on the lower arm and one on the trunk. 3 lesions. The dermatologist diagnoses the lesion of the trunk as seborrheic keratosis and the patient elects to have no treatment since it is benign and does not cause any discomfort. Out of 3 lesions, patient does not require any treatment for 1 lesion. And the 2 lesions on the right arm and the left leg are suspected as basal cell carcinoma. And the dermatologist performs a shave biopsy of each site to help them make a definitive diagnosis. What CPT codes are to be reported? Shave biopsy, it is nothing but a type of tangential biopsy. 2 lesions are involved. So 2 biopsies are performed. So the appropriate CPTs are 11102 tangential biopsy of skin, shave, scoop, saucerize or curette, single lesion, followed by add-on code 11103 tangential biopsy of skin, each separate or additional lesion. Now coming to next topic, removal of skin tags. So what is a skin tag? A skin tag or acrocordon. A skin tag or acrocordon is a small benign tumor that forms primarily in the areas where skin forms creases. So the various CPTs for removal of skin tags are 11200 and an add-on code 11201. The description of 11200 is removal of skin tags, multiple fibrocutaneous tags, any area up to and including 15 lesions. The next is an add-on code 11201, removal of skin tags, each additional 10 lesions or part thereafter. So for first 15 lesions, you will report 11200 and for each additional 10 lesions after 15 lesions, you report it with add-on code plus 11201. Now let us discuss an example. Patient is here to see us about some skin tags on her neck and both underarms. She has had these lesions for some time and they are irritated by her clothing, itch and at times have burning sensation to them. We discussed the treatment options along with risks. Informed consent was obtained and we proceeded. We removed 16 skin tags from right axilla, 16 skin tags from left axilla, 10 from the right side of the neck and 17 from the left side of the neck. What CPTs are to be reported? So the first CPT is 11200, removal of skin tags, multiple fibrocutaneous tags, any area up to 15 lesions, including 15 lesions. So how many lesions are done here? 16 plus 16, 32, 42, 10 from right side of the neck, 42 plus 17 means 59. In total, 59 skin tags are there and they are removed. So for first 15 skin tags, you will give with 11200. And for remaining 44, so for every 10 lesions, each additional 10 lesions, you report this. So for 44, you report it with 5 units of 11201. So the appropriate CPTs are 11200 for first 15 lesions or skin tags, followed by 11201 5 units into 5 for each additional 10 lesions. Now coming to the next topic, shaving of epidermal or dermal lesions. The CPTs are 11300, shaving of epidermal or dermal lesion, single lesion, trunk, arms or legs, lesion diameter 0.5 centimeters or less. The next is 11301. Here the lesion diameter is 0.6 to 1 centimeter. For 302, the lesion diameter is 1.1 to 2 centimeter. For 303, the lesion diameter is over 2 centimeters, and 305, 305 is shaving of epidermal lesion, single lesion, scalp, neck, hand. Another location. Scalp, neck, hands, feet, genitalia, lesion diameter 0.5 centimeters or less. 306 is lesion diameter of the anatomical region, scalp, neck, hands, feet, genitalia. Lesion diameter is 0.6 to 1 centimeter. 11307, the lesion diameter is 1.1 to 2 centimeters. For 308, the lesion diameter is over 2 centimeters. And the next code is 11310. Shaving of epidermal or dermal lesion, single lesion, face, ears, eyelids, nose, lips, mucous membrane, etc. Lesion diameter 0.5 centimeters or less. The code 11311 is nothing but lesion diameter 0.6 to 1 centimeter. 11312 governs with lesion diameter 1.1 to 2 centimeters. 11313 deals with lesion diameter over 2 centimeters. Now let us discuss an example. A patient presents with recurrent seborrheic keratosis of the left cheek. Area was marked for shave removal. Here the location is left cheek. Area was infiltrated and local anesthesia and prepped and draped in sterile fashion. The lesion measuring, the diameter of the lesion is 1.8 centimeter. Location is cheek and the diameter of the lesion is 1.8 centimeter was shaved using a 11 blade. Meticulous hemostasis was achieved using light pressure. Specimen was sent for permanent pathology. What CPT, the patient tolerated the procedure well, and what CPT code is to be reported. Here the location is cheek and the lesion diameter is 1.7. So the appropriate CPT is 11312. 11312. Shaving of epidermal or dermal lesion, single lesion, face, ears, cheeks come under face. Face, ears, eyelid, nose, lips, mucous membrane, lesion diameter 1.1 to 2 centimeters. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.